Hello and welcome to Health Affairs This Week. I'm your host, Jeff Byers. We're recording on December 19th, 2024. It is the last Health Affairs This Week episode of the year 2024. What a year it was. Before we begin the show, I wanted to share the news that our editor-in-chief, Alan Weil, is leaving Health Affairs at the end of the month. He'll be moving on to AARP in the new year. If you are a listener of our podcast, A Health Podyssey, know that we will return, but there may be a little longer delay as we transition hosts. But today we are talking about national health spending. Yesterday, Health Affairs, along with CMS, released the national health spending data from 2023. You can read that report on our website, so check the show notes. It is an ahead of print article, and it will go into our January 2025 issue, but you can read it today. To discuss, I'm joined by Leslie Erdelack. Leslie, welcome back.
Hey, Jeff. Good to be back. The year-end countdown is on.
That's right. Happy holidays. How are you getting on?
Yeah. I'm still waiting for the all is calm, part of the year to kick in here, but I'm doing well.
Cool. Okay. You're just hearing 5 golden rings over and over again?
Over and over again. Mm-hmm. But no complaints.
Well, fantastic. Leslie, we are talking about health spending data today. We released the report yesterday. Can you give us the top line findings for health expenditures in 2023? What jumps out?
Yeah, and I do want to say the National Health Expenditure Accounts, this is like the gold standard for measuring healthcare spending in the U.S. It looks at spending across all sectors of healthcare, but it goes even deeper than that. The accounts track not just how much is spent, but who's doing the spending and what they're spending it on. And I think the historical significance here was noteworthy to me. This data has been around. It's been maintained since 1960. So it's able to give us a long-term view of how healthcare spending has evolved over time. So in this latest report, we find out that the U.S. spent $4.9 trillion on healthcare in 2023, and that's a 7.5% increase from the year before. And a few things stand out to me. So first, these estimates tell us something about how fast healthcare spending has grown. There was a noticeable speeding up compared to the previous 2 years. So we saw pretty modest growth where healthcare spending increased from about 4.2% in 2021 to 4.6% in 2022. But there was a significant uptick in 2023. And healthcare typically accounts for a larger share of the U.S. economy. This is not anything new. Healthcare spending as a share of GDP constituted about 17.6% in 2023. And the pandemic, it caused a lot of volatility. We were seeing trends that we weren't used to seeing with respect to healthcare spending and GDP growth. But it would appear that a lot of that disruption has kind of settled down. GDP grew by 6.6% in 2023. Healthcare spending grew by 7.5%. So even when you adjust those estimates for inflation, healthcare costs are back to outpacing growth in the economy, which means that, all of the basic drivers of health spending are more or less starting to resemble those that were in play before the pandemic. So in this way, I think one could argue that healthcare spending is normalizing, not just rebounding.
Yeah. Are you saying we're back?
We're back.
We're so back
in business.
Yeah. And for anyone that's interested about the historical context, Laura Tolan, our colleague here at Health Affairs, in her health spending newsletter, which you can get if you are a member of our Insider program, has a nice interview with Ann Martin, who also is one of the, I think, if not one of the lead author of this report. And Ann and her dive into the historical background to this. So check that out if you're so inclined. So this is a big report for us and for CMS. It gets a lot of play in the media. I saw this morning that Axios focused on the hospital care portion and how the rate of growth was its fastest since 1990, with hospital spending increasing to 10.8% in 2023. But Leslie, I want to ask you, are there any notable trends for you that you noticed across these sectors?
Yeah, so hospital care, I do want to talk about that, but just a couple other things that caught my eye. So enrollment in private health insurance went up, as did spending. Private health insurance spending went up by almost 12% on things like hospital care services and prescription drugs, but the insured population also went up to just over 92%. So that's a record high. Two other things. Federal Medicare expenditures also increased by about 13%, partly due to some of the provisions that were in the Inflation Reduction Act, which lowers cost sharing for insulins and vaccines, but in return forces Medicare to take on more financial responsibility. And healthcare spending by households increased too, with total out-of-pocket spending increasing by about 7% in 2023. So that's just over $500 billion, lots of big figures to sort of digest here. So with the hospital care piece, yeah, this is the fastest growth that we've seen since 1990. And it looks like that increase was in outpatient hospital use. I mean, there were increases in inpatient and outpatient prices, and those are responsible for growth in hospital spending for Medicare specifically. But there was also an increase for demand for medical procedures. We know that hospital prices stayed about the same. Spending for physician and clinical services went up. And so in both cases, economists say these estimates suggest that growth in the use and the mix, or sort of the intensity of healthcare goods and services, are what's causing this. And we know a lot about the financial strain that hospitals experienced during the pandemic. So I'd imagine a lot of that spending is associated with deferred medical procedures. But yeah, it's getting a lot of play in the media.
Let's look into prescription drugs. It looks like there is like a 9% share. Let's break that down. I'm just pulling out a percentage and I don't know what I'm talking about.
There's you and me both. We're doing our best. There are lots of numbers in this report to dig through, which is great. But I think, so what's happening with the prescription drug market, I think kind of tells an interesting story. So there was only a 2.9% increase in the number of prescriptions that were dispensed, the number of prescriptions that were filled, but spending on retail prescription drugs went up by about just over 11%. So this is mostly due to spending by private health insurance and Medicare, but it's also coupled with this shift toward higher cost brand name drugs, particularly those used to treat diabetes and obesity, and faster growth in drug prices. So brand name drug prices increased faster than generic drug prices in 2023. Out-of-pocket consumer spending on prescription drugs also increased, but it actually slowed down a little bit in 2023 compared to the previous year. And that could be because of things like coupons from drug manufacturers and insurance caps on out-of-pocket drug spending. So a lot of different dynamics going on there.
Yeah, it's. I don't want to get political. I'm not a political guy, but it is interesting with the incoming administration what they might do with the GLP-1 drugs that focus targeting obesity. When you pull out that stat that there was more spending on obesity drugs, I don't know if they in the report marks out the GLP-1s, but it is interesting that they're pretty expensive so far, and there's some incoming clashes from the incoming administration about how to handle those classes of drugs. One thing that's interesting is that if people reduce their weight, in theory, health spending can go down later in life. Or again, this is not a wellness podcast, as we talked about off mic, but could be interesting to watch. Yeah. So we'll table that for another day when politics is on the table. But so going back to the data, how does this compare to 2022? You said that we're back, but how back are we?
Okay, so I would say the big takeaway here, and I think what really kind of came out for me in this report, is that healthcare spending really started to show more typical patterns in 2023 compared to 2022 and recent years. So I mentioned healthcare's share of GDP returned to levels similar to those seen before the pandemic. The federal government also accounted for a lower share of spending this time around, as we saw pandemic-related funding start to phase out and state and local government spending increased as a result. So some of the costs associated with Medicaid shifted back to the states too. And then just big picture, kind of coming back to that, there's the fact that more people got insurance through the ACA marketplace during the pandemic, thanks to those enhanced subsidies that were instituted through major legislation like the American Rescue Plan Act and the Inflation Reduction Act. And expanded coverage is likely to be contributing to greater healthcare utilization and spending as more people have access coming out of the pandemic. And so that to me is the big takeaway when we look at 2023 compared to 2022 and years when we were sort of in that more acute phase of the pandemic.
Oh, well, thanks for breaking that down. As you know, we do publish CMS's healthcare spending projections earlier in the year. How did this compare to those projections?
So both articles they both look at U.S. healthcare spending, but they offer, I think, slightly different numbers and perspectives. So they both, I think, suggest that 2023, again, was kind of this pivotal year in healthcare spending where we saw, again, increased utilization of services, strong private insurance growth, and sort of this gradual unwinding of pandemic era policies. And so this is both reports sort of point to this as being a transition period, moving from the pandemic-driven policy changes toward more traditional patterns of healthcare spending and delivery. The article on projected costs models expenditures all the way out until 2032.
That's right.
And by then, we might expect to see healthcare spending as a share of GDP reach almost 19, maybe almost 20%, assuming healthcare prices continue to increase along with average growth in the use of healthcare services and goods.
Well, then with that, I will see you in 2025 to talk about this year. Is there anything you wanted to note before we wrap up?
I would just maybe offer a few thoughts on just sort of taking this report and these findings in a broader economic and kind of policy context. I think we said there are a ton of numbers in this report, but what I want to say is these spending increases, they're not just happening in isolation. They're happening because we've got this backdrop of post-pandemic. We've got economic recovery, advancements in medical care and pharmaceuticals, and other major policy changes. I think the one thing I'd keep an eye on is that shift that I mentioned from federal to state governments, particularly in Medicaid. I think that continues to create some fiscal challenges heading into 2025. That increase in hospital spending that we've all been talking about, it's the highest I mentioned it's ever been since 1990. I think that has a lot of implications for hospitals and health systems more broadly. I think potentially could struggle to adapt to meet that rise in demand for medical procedures. But for now, I think it looks like the economic and demographic drivers of health spending are back to what we've come to expect heading into the new year. So in many ways, these challenges in healthcare are pretty routine. They're kind of perennial. And so I think that much of what we're focusing on now in terms of policy is just going to carry over into 2025. But I will be glad to come back and talk with you about those.
Well, fantastic. Leslie, thank you for joining us today on Health Affairs This Week. Thanks to you, the listener. If you enjoyed this episode, send it to the mathlete in your life, and we will see you in 2025. Thanks all.
Awesome. Thanks, Jeff.